If this muscle become the weak, and then this muscle become too stiff. Okay? When we write the 3 star, that means that is the main muscle in that group, and 2 star, that is the supporting main muscles, and 1 star, that is not that much. If the vastus medialis become the weak, what will be positions of the knee? Vastus medialis become the weak.
Outside and fall outside.
Bow leg. Bow leg. People will walk like this. Okay? There was 2 patients yesterday. One that the fat one.
Yes.
The second, then again that fat guys who came here.
Bow leg.
Both are bow leg. Okay? So
That's
there was one yesterday. Yesterday there was one knock knee patient also.
Yes.
If you remember the Sardarji
Yeah.
with knock knee,
Yeah.
his leg was like this. Who treated him? I think you did.
Deformity.
The one old guy Sardarji.
Yeah.
He was a knock knee. His leg was
Yes.
like this. Okay?
So he's
Then we have a hyperextension muscle, which is the cause of vastus intermedialis. Okay?
Extension.
Who? You have?
Yeah.
No? Okay. Hyperextension. That means the weakness of the vastus intermedialis. Okay? If these 2 muscles stiffness, I have seen just one of the case in thousands. But this muscle become the weak also, and this muscle become the stiff too. If this muscle become the stiff, no. For example, yesterday the young guys came for the knee pain, if you remember, with the slip disc patient.
Okay.
Okay. Yeah, this guy is complaining pain inside the knee, and if you ask him fold the leg, he can fold very easily. He can bend he can do like more hyper extensions. That patient was also hyper extension. Okay. And if vastus intermedialis become a stiff, and what will be conditions of the knee?
Deep pain.
No.
If they become weak,
Yeah. Then it is
then hyper
overextension.
extension. If the vastus intermedialis become the stiff,
Legs
Straight.
they will stand like this.
Yes.
They are not able to
Stand
stand properly, and they are not able to bend the knee properly. The both guys were not able to bend. Okay. If the only one muscle weak, then sound will come only one side. Like vastus medialis weak, then they will feel the sound only here. If vastus lateralis weak, then only on the lateral side.
Both weak.
But when you check, for example, put your 2 fingers on the knee eye, okay, lateral and medial side of the patellar tendon and here, and try to flex and extend the knee. If you feel that sound, the curve sound in all over the knee, that means dryness inside the knee. Okay, with that what we do the same orthopedic acupuncture. What we learned yesterday, we do the same treatment. What we ate yesterday extra.
Yeah. Meniscus and disc.
Yeah, we put the 2 needle, copper needle, okay? Always when you are giving the moksha, no? So we use the copper needle. Why copper needle?
It gives heat.
Conductor.
There are 2 types of the needle. In the traditional time, they use like silver and gold. Okay? So then, of course, if you are using gold needle, like this, then 5,000. Okay? So the same, if you see the like structures and properties of your gold and copper, they both are same. They both absorb the heat.
Okay.
Makes sense? And if which is the silver, silver mostly reflecting the heat. It means taking the out vata and pitta both. I don't think so that is that much effective. Silver is just, I use general tonifications. You use just to stimulate the muscle.
Silver is cool.
But copper is effective. Okay, if you are giving the heat on the copper, no, that heat is going inside. So the best way, insert yourself and try to give the heat and feel the how heat that's expanding inside your body. Okay, so there is lots of the dryness inside the knee. When you give the heat, there will be more lubrications, maybe more fascia separations will comes there. But with this, when knee becomes fully dry, we will not do only orthopedic acupuncture.
Because they have to fix the internal problem.
Yeah, dryness is comes from pathological imbalances. Some gas imbalance, some acids imbalance, or maybe some fluid issues. Okay? For example, yesterday what we diagnosed that patient? The young man, the knee.
We gave him some heat, right?
Yeah. What I said? His intestine is very, very toxic. His intestine is not able to absorb water.
Oh yeah, you said.
Okay? Whenever he is drinking the water, his body is not absorbing at all. Understand? So that's why the people having the more. When water is not
Yeah.
absorbing,
Yeah,
of course,
that's
for collagens and fascia need the maximum amount of the water. Okay, so in that condition, the body is not absorbing the water, then there is dryness. Right now, he is suffering with only these and 2, 3. But slowly it comes in all over the joint.
Oh.
Okay, so in that condition, we use the pathological treatment too. That we use through the tongue diagnosis. Secondly, what we use the tongue diagnosis? As per tongue diagnosis, we use. On the tongue, we can diagnose knee. Okay, we'll check the tongue and we can diagnose if there is right knee issues that we can see on the tongue. But only that knee issue which comes from the pathological problem.
Ah, okay.
If you have the orthopedic,
Then it won't be on the.
yeah, if you have the muscular problem, no, then that will not come on the tongue. If you have some vata pitta kapha imbalance, which means acids or fluids or gas imbalance inside the body, that's why there is dryness in the knee. That we can diagnose on the tongue. Got it?
Oh, that's
Okay, now we start knee flexion. You understand now what is the flexion and extension? Which part is bending more? That is a flexion. Okay, going back to the position, that is extension. So in these two, which is the flexion, which is extension? For example, in these two, both sides going.
This is extension and this is flexion.
Are you sure?
Yeah.
Both
If,
are.
if you see, like of course we understand this is flexion, this is extension. But what about the shoulder? Going like this side, going this side. Which is the flexion, which is extension?
Extension and this is flexion. Extension.
This
So what's this?
both are.
Which is the folding on the more degree? For example, like this, you can go 90 degree.
yeah.
Maybe some hyperaction who is doing the yoga they can go more